Hello everyone, welcome to NDARC's weekly webinar. My name is Michaela Kowalski and I'm a postdoctoral research fellow here at NDARC, and it's my pleasure to be hosting today's webinar. I want to start by acknowledging the Bidjigal as the traditional custodians of the lands from which I'm joining this meeting, and acknowledge the traditional owners of country throughout the land, noting that our speakers and audience are joining from many different locations across Australia. We pay our respects to the elders past and present and honour the enduring connection of Aboriginal and Torres Strait Islander peoples to country. Now, it's my greatest pleasure to introduce today's speaker, Dr. Nic Taylor. Nic is an alcohol policy researcher at the National Drug and Research Institute. His work involves the use of epidemiological data to monitor alcohol consumption trends across Australia and track trends in alcohol-related harm. His program of work includes monitoring trends in youth drinking, evaluating the impact of alcohol restrictions on violence and vibrancy in nightlife settings, and evaluating the impact of the Northern Territory's minimum unit price on consumption, consumers, and harm. In this webinar, Nic's going to be providing us with an overview of monitoring alcohol consumption methods in Australia, while discussing historical and current methods and how to move towards best practice. We'll also have the opportunity to hear from Associate Professor Mark Robinson during the question and answer time. Mark is a Principal Research Fellow at the Institute for Social Science Research at the University of Queensland, as well as an Honorary Senior Research Fellow at the University of Glasgow. He's a public health and evaluation specialist with a particular interest in understanding, influencing, and evaluating the social, economic, and commercial determinants of health and health inequities. Nic and Mark are going to be taking questions from the audience after Nic's presentation, so please use our Q&A function to pose your questions from the panel. I'll be putting as many questions as possible to the speakers at the end of the presentation. Nic, your camera's on. I'm going to hand it over to you.
Sorry if I came in a bit early there, Michaela. Excellent. Welcome everyone, and thank you very much for that introduction. Today I'll be talking about monitoring alcohol consumption in Australia. And yeah, really I'll be breaking it down by how we do it currently, how we have done it, and where we should really be heading. Before I get into that though, I would like to echo Michaela's acknowledgement of country and acknowledge the traditional custodians of the land on which we're all sitting today, and acknowledge that sovereignty has never been ceded. So before I get into the bulk of the discussion, I sort of wanted to start this with the framework or the reference point that the rest of this presentation is sort of built upon. Which is to say, alcohol is a legal drug in Australia. It's considered a culturally and economically important drug. However, it is also a harmful substance. And for this reason, we regulate and monitor and control the sale of alcohol in Australia. Which is to say that the sale of alcohol isn't something everyone can do. It's a privilege that's afforded to liquor retailers, usually through a liquor license. And the regulation and control of this, the sale of this substance, is aimed at reducing or limiting the harm that's associated with alcohol use. With this in mind, I think that the privilege to sell alcohol should only really be given when retailers comply with these aims or the purpose of liquor regulation in the first place. And hopefully, if you agree with that, you'll agree with everything else that comes after. But if not, happy to hear about and happy to take questions on that as well. So monitoring alcohol consumption. Why should we do it? The main reason is, like I've said, that alcohol's a harmful product. It had population level use is associated with higher levels of population harms. So it's really important to monitor what those levels of harms are, as well as monitoring trends in alcohol use helps us understand changes, not just in drinking patterns, but also in potential harms or emerging trends, and allows us to sort of create policy or interventions or responses to what we see emerging. Without this, we're sort of going in blind. So hopefully, we can prevent harm as well as monitoring consumption through this. So what's important to monitor? I should stress it's not just alcohol products that are important to monitor. Usually, you want to monitor the ethanol content, which is the active component in alcohol, as well as there are other important factors that are associated with harm and therefore are really important to monitor as well. The location that alcohol is being consumed is an obvious one, whether that's state or region based. It's important to know how consumption differs across the population geographically. You also want to know the kind of retailer or the form of sale. So whether that's on license, off license, maybe it's delivery. That's becoming more prominent lately. It's important to know where these trends are emerging, not just that alcohol is being consumed. Liquor type, possibly debatable, but different consumption of different types of alcohol has different indicators. For example, different meaning. For example, wine is not taxed very high, so growth in wine sales might be an indicator that something is wrong there, or that we should adjust our tax system to compensate for that. Price point's an obvious one. However, how affordable alcohol is associated. Oh, sorry. The more affordable alcohol is, the more likely it is to be associated with harm, particularly at a population level. Time of sale is another really important one, particularly in nightlife areas. The later the sale of alcohol, the more harm that's associated with it. And then sale quantity. I say sale quantity, that doesn't just mean, how much alcohol is being consumed overall, but something I think we could really move towards, and, spoilers for later in the session, but it's not something we measure very well, is how much alcohol is obtained in any one purchase is something that I think could be an important indicator. So the benefits, again, it's a predictor of health. It's a predictor of poor health as well as increases of violence. Another reason why it's really good to have a consistent monitor of alcohol consumption is because we introduce policies to prevent harm from alcohol. And without these consistent indicators, it's really difficult to determine whether or not they're having the intended impact or potentially unexpected impacts. And another little fun one at the end there, that last up point, is that it might be a good way to monitor how the alcohol industry is going in different regions in Australia as well. So it's not all public health. So how do we monitor alcohol consumption currently? The most obvious example is the Australian Institute of Health and Welfare's apparent alcohol consumption in Australia. If you haven't seen it, I very highly recommend you go look it up, maybe after the presentation. But basically, these estimates of alcohol consumption are derived primarily from tax and duty data, as well as some inferences from the Consumer Price Index. This is a national level measure. States and territories can be informed by some surveys that take place, but more importantly, and what we'll discuss in more detail, is targeted sales collection that's undertaken in some jurisdictions. So just a note about taxes and duty payments. It's a really good measure on a national level. It's very consistent. The tax office actually releases weekly spirits and beer sales, although that doesn't include, not sales, sorry, taxes. That doesn't include what's being imported. You have to purchase that through the ABS, but it's very affordable. If we want to have a monthly examination of beer and spirits trends, it's very achievable, although only at a national level. one of the issues with this, though, is that there's no indication of where or how this is being consumed. So, to bring up the example of home delivery again, obviously that's grown as a space in the last decade. You wouldn't know how much beer or spirits is coming through there, or is coming through the supermarket, or is going through nightclubs or pubs or something like that. Um, as well as I keep just saying beer and spirits because they're the only ones that are taxed on alcohol content. Wine and cider needs to be inferred, and in fact, it's inferred by the Australian Institute of Health and Welfare through the tax that they pay, which is based on final retail sales price, and some inferences about like the value of that and the average amount of alcohol that's in these products, typically assuming that that remains consistent over time. So there's no reason to think that those are particularly bad estimates, but they can't be as precise as beer and spirits. So yeah, just a quick note about surveys. The surveys get a lot of hate, unfortunately, for, occasionally you miss parts of the population. That's true, you do miss key parts of the population, but they're really second to none in terms of learning about the individuals who are consuming alcohol. But unfortunately, they are really expensive. So you need big projects to be able to afford these kinds of things. You need a lot of funding, and often you can't do it consistently, or you may be only able to do it annually. So very limited, especially when compared to like weekly tax data. Some research that we've done has shown that they're actually really good indicators of what people are drinking. So if people say they drink wine in a survey, that matches up with all the other indicators of how much of the population is drinking wine. But then if you look at how much they report drinking and the amount they spend on alcohol, there's limitations to that. You can't really extrapolate those answers to the entire year in a consistent manner. And as I noted, there are key populations that are underrepresented there. I guess the bulk of what I want to talk about in terms of states and territories is targeted sales collection. So, well, not most states, but many states historically have collected wholesaler data, which is, I have a slide about this later, but it's data, it's the people who sell to retailers, it's data from those sources. This has been seen in the Northern Territory, Queensland, Western Australia, and Victoria, as well as a little bit in New South Wales in the 90s, but not regularly. That's, as far as I can tell, that was part of like targeted research projects. Then there's retailer data collection, so straight from the point of sale. So, collecting any information that might be important directly from the source straight to the consumer. New South Wales has had two examples of this, one in the King's Cross Nightlife District, as well as currently running with home delivery services, or I should say same-day delivery services. Apologies, they're not quite the same thing. This slide's a bit redundant now, I can see that. But basically, yeah, wholesalers sell to retailers, retailers sell to the consumer. I'm going to skip ahead because I have two more slides to talk about this. But the benefit of wholesaler data is essentially there's a small number of operators, so collecting data is pretty achievable. You do get some indication of geographic variation. The data is often collected in the form of who they're selling to. So they know the postcode that their alcohol is going to. They know a bit about the retailer, whether or not they're an on or off license premise, for example. And internationally, particularly in the UK and Scotland, we've seen wholesaler data include information like typical prices, which we haven't seen that kind of data in Australia, but it is possible. Some issues with it, it doesn't necessarily cover sales or wholesalers coming from interstate. That does differ by states, but it's been an issue that's been raised before. Retailers that have like a central distribution hub often mess up any sort of geographic analysis you want to do, they often make you aggregate higher as a result. There's no information from the point of sale, so you can't know the time or the exact price. For example, if it went on like sale, if it was sold cheaper than intended. Um, and in some states, I've only found this out recently, but retailers don't actually have to check that their product was purchased from a registered wholesaler or producer. So there is alcohol that slips through the gaps here. Um, so as I noted earlier, there has historically been quite a few states that have collected wholesaler data. Um, However, I do recommend you look up the National Alcohol Sales Data Project, the last report of which was in 2016, so quite a while ago. But this project brought together data from multiple states to try and get an idea of how alcohol consumption differed by region and across time across Australia. It's a very ambitious project. And unfortunately, we've really only gone backwards since then. So there are, as far as I'm aware, there are only really two states still consistently collecting wholesaler data in this nature. Western Australia is one of them, and unfortunately, that data can't be released due to some privacy laws. It, which means that it's being collected, but the community and researchers can't really take full advantage of that. Unlike the Northern Territory, which is really the gold standard in this space, which not only actively collects and allows people to access their data, but they publicly publish it uh, every quarter. So you can see this graph on the side here is a quarterly trend. Unfortunately, the bottom axis has messed up a little bit, but it's to the middle of this year, dating all the way back to 2001. So it's a really consistent trend, and it's meant that we can evaluate alcohol consumption levels in the Northern Territory in a way that's just impossible in other states, with a level of consistency that, again, can't be achieved anywhere else. And what's really neat about this data as well is it has been used to look at the type of retailers that are being sold to as well. So differentiating impact between off-license and on-license. That isn't public, but the Northern Territory government has worked with researchers before to look into that sort of impact. So this is really cool data, but it only exists in one jurisdiction of Australia. So what about the other side of the coin, retail sales? Retail sales are the peak. They're the top of the mountain, if you will. There's so many benefits to getting retail sales. You know the exact location alcohol was sold, when it was sold, the price it was sold at, how much alcohol was bought, if two types of alcohol were purchased together. And in some case, method of purchase, so on license, off license, delivery, something else that'll happen in the future, I'm sure. But you also, in some instances, know purchaser characteristics. Now, this data is not really collected by the government at all, but there are cases where retailers collect and report on this sort of information, which we'll get into later. The issue is that there are a lot of retailers, and that puts a heavy burden on the government and liquor regulators to go out and collect this data. It is also arguably a burden to retailers to collect and report this data. Although, again, we'll discuss that more later. I have more to say on retailers. In terms of examples, there's the King's Cross mandatory data collection, which occurred from 2014 to 2018. Nightlife venues in King's Cross had to report hourly sales by liquor type, and they had to report like the standard drinks, like the pure ethanol that was in there as well. And this graph's from that data set, and you can see that this is a pretty basic graph, but we can map how much alcohol is being sold over the course of a night. Unfortunately, it was stopped. Again, it was largely because it was a burden to both liquor retailers as well as the government. The government in particular had to very actively be on top of retailers to get this data, And once enforcement sort of dropped off, so did compliance. Again, this data wasn't really ever made public. It's only really been I've only got access to it through a GEPA for anyone who knows what those are. But it hadn't been utilized, so its purpose was, I guess, sort of up in the air. And again, I note the fluctuating data quality as compliance fell. So same-day delivery mandatory data collection. This is ongoing. So from the middle of 2021, the New South Wales government collects postcode level data on how much alcohol is delivered through same-day delivery by liquor type and in sort of 6-month chunks. And it has really, because it's across the entire state, you get really good geographic variation. Unfortunately, there are severe limitations with this data collection. It doesn't capture delivery times or how long it takes for the deliveries to make, which is sort of a core concept in this area, is how fast or rapid are the deliveries. And due to the high number of, or due to there not being sort of a liquor licensing rule on whether or not you can deliver alcohol, it's not part of your liquor license. It's very hard to enforce or know which liquor retailers to go after. But as you can see from this heat map, the variation in geographic data is really interesting and meaningful. We can really look across, this is Sydney for those of you, or the Greater Sydney region for those of you who are unfamiliar, but we can really see how home delivery is distributed across, well, both the state, but also Sydney in this case. And there has been some industry data on this exact area. And the data that the government is collecting is really closely matches industry. The data collection isn't perfect, don't get me wrong, but I often worry that in terms of sales data, we often let perfect be the enemy of good. This data, again, is not public. I had to make a specific request for it, which means it's been really underutilized. And the reason why it's not public is because of data quality issues. But yet there's still something to learn here. The data's not perfect, but there is a unique story here, and we can see that when we validate it against industry data. Speaking of industry data, now to talk about the industry. So the alcohol industry have retail sales data, as it turns out. Notably, Retail Drinks Australia, which is a lobby group for the off-license or off-license alcohol retailers in Australia, has in the last few years begun publishing reports or commissioning reports using their retail sales data. And they do this in order to undermine they do this to undermine public health policy and also to attack public health researchers. The novel thing about this, though, is that the data is incredible. I can't speak highly enough of the nature of the data that they're collecting and publishing on. They have incredible coverage of upwards of 80% of all off-license sales in Australia. They have data by the transaction level, and they've examined it in that manner. They can track individuals who make multiple purchases across time. They can look at the price, the hour of sale, the speed of delivery, and they've reported on all of these things, I should say, the quantity of each order, the price of each order, liquor types, some age and gender variables in specific circumstances, the retailer that sold it by, as well as the region that that the sale was made in. So they have really high quality data that they're publishing these reports with. However, the industry, whenever retail sales data comes up as a topic, which isn't very often, but it comes up occasionally in some state jurisdictions, will claim that this is a burden. This is an undue burden on their businesses. But yet they continually demonstrate that they actively collect this data and use it for business interests rather than potentially public health ones or community ones, if you want to word it that way. So this is a bit of a fun slide, but I'll go through it quite quickly. The picture to the right is an extract from a retail drinks agenda minutes. I think it was minutes from one of their meetings where they discuss how not to be a cartel or the legal things they're not allowed to do in order to avoid being a cartel. And the reason I talk about this, the reason I talk about like competition laws is because Retail Drinks Australia as a group and aggregating all of this data, the reason they talk about we need to avoid being a cartel is because by sharing this confidential commercial data with each other, they are creating a scenario where they have an incredible advantage in the market. And this is mainly big retailers have this huge advantage where small retailers who might not want to buy into Retail Drinks Australia or may not be able to afford it are suddenly at a loss when, and we can see that actively with these reports that are coming out, that there is some level of data sharing going on for those businesses' interests, and exclusively for their interests. And I guess the point that I'm making overall is that this really undermines the purpose of alcohol regulation that I opened with at the start. The idea that this data is being actively collected and used almost exclusively to undermine alcohol policy, it really goes against the whole purpose of regulating the sector. So where should we be moving to? I've put the NASDAQ, I guess, logo or whatever this is. It's from one of their reports, I believe, because we've gone backwards in Australia on this topic. We really need to move back to collecting wholesaler data like we were back in 2016, although pre-2016, really. We need to get back to where we were, but we need to build upon that because it's not enough. Taxation is great. We should edit or we should change how our taxes work so that we have better monitoring of wine and cider, for example. We should be collecting wholesaler data in every state. And we should also be collecting retailer data from every retailer that we can. And there's a lot to gain from engaging in this approach. So I've already sort of talked from a public health perspective in terms of the kind of benefits that we can see from getting this data and its value to research, but also value to the community and public health. But there are other people who will benefit from a improved alcohol monitoring system. I mean, namely the government. The improved ability to monitor how our businesses are going. If this is important to the economy, important to the culture, and that's something the government wants to promote, then of course having a better understanding of how those sectors are performing with a direct measure is going to be a lot more informative than talking to a lobby group. There's also some of you may know there's a tax gap in this. There's an alcohol tax gap in Australia of roughly $1 billion. I think it's actually 880 million-ish to be more precise. But improved monitoring would mean that we could see where these shortfalls enter the market. So improved monitoring has a direct financial implications for the government as well. The health and justice systems, these points are more or less the same, but improved monitoring of alcohol consumption only has benefits for these systems, both in terms of prevention, but in terms of actively being aware of where alcohol-related harm or violence may occur, can directly inform the actions of health systems as well as justice systems, like police, for example, can target targets may be a wrong word, but appropriately send resources to areas where alcohol use is disproportionately high. As well as it helps identify where bad actors might be in the market. So, for example, if you had wholesale data and retail sales data at the same time, and a retailer is selling more than they're getting, you would know that they're selling alcohol from someone who's not a wholesaler, which is potentially, illicit substance in that area. So again, a really important tool that doesn't exist in Australia, but easily could with the data collection that already exists. Small retailers would also benefit from the improved data access across their sector without necessarily having to be part of groups like Retail Drinks Australia to get access to that large quantity of data. And arguably, the alcohol industry as a whole would benefit from better data monitoring in Australia because they wouldn't have to commission so many reports. So, something I just really briefly wanted to touch on is that this was almost an actuality in the Northern Territory. In their 2019 liquor bill, they introduced a retail data collection. However, it was removed before the bill eventually became law, and largely this was due to a couple of factors. Opposition from the alcohol industry claiming burden, but also because the people who could advocate for it weren't really aware of the full range of benefits that you get from point of sales data collection. So as a result, it was seen as redundant and unnecessary in a region that already has good wholesaler data collection, when in actuality it could have been a great improvement to the system as a whole. And particularly, the Northern Territory is a great example because we can see from industry reports as well as reports the government has put out that the industry is collecting this data, and it's collecting it for a substantial portion of the alcohol that's being sold in the Northern Territory, but again, only for business purposes. So what is in the way of moving towards best practice? One that I haven't noted here, but I should note, is that obviously not all the systems are in place yet. It would take time. It also, in researching this, there are obvious differences between states, but the issues between states could be resolved from an approach at a national level. It's state level liquor regulators who are in charge of a lot of this, but it's the federal government who bring in the excise tax and chase revenue from in that regard. So it is a cross-jurisdictional issue, and it sort of needs national level leadership in order to carry it forward. Or at least I think that would be the most ideal form. Obviously, states should pursue this on their own. But getting to the actual point of the slide, the alcohol industry is obviously going to oppose something like this. They have control of the data. They don't want to share it. Why would they? It's against their interests. Which again undermines the entire purpose of regulating or controlling the sale of alcohol as a business. It's allowing those who benefit from the sale of a harmful substance to control knowledge of the harmful substance. But something I find interesting is that right now, if you go on Retail Drinks Australia's website, they have a couple of reports talking about, or maybe it's just the one report, talking about theft and violence in takeaway liquor shops. And really, it's just a push for the government to start funding security technology in these retailers. But the level of harm that comes from that is minuscule compared to the level of harm that the alcohol being sold in those establishments cause. So if there's going to be any call or any funding to improve these establishments, it really should be aimed at improving the data monitoring aspects that exist within them. It is a real complaint from small venues that the technology needed to monitor alcohol consumption is costly. But the industry is calling for investment, but the investment should be one that benefits the entire community and not just the interests of the liquor industry. Another thing to note, and I think this is really important, is that this will be a burden to liquor regulators, and data collection needs to be built in a way that eases or limits the burden on liquor regulators, but also takes advantage of the many experts that work in this space across Australia, and in some cases are funded either directly or indirectly by the government to work in the alcohol space, but are not necessarily liquor regulators. For example, research institutes, drug and alcohol research institutes. There's a lot of people in the space that could be, their expertise could be utilized to ease access of this data or the utility of this data. And that's everything. Thank you very much. Whoop.
Thanks, Nick. That was quite a comprehensive overview of kind of methods. And yeah, we'll dig into it in a minute, but I'm going to invite Mark, our panelist, to turn on his camera and microphone. Mark, welcome, and thank you for joining us. Before we get into kind of questions from the audience, I'm wondering if you want to offer any reflections about the overview from Nick and just the issue of monitoring alcohol consumption.
Sure, thanks, Michaela. I've got lots of thoughts and reflections. I don't know how coherent they are, so I'll try and articulate them concisely and clearly. Well, first of all, thanks, Nick, for such an insightful and thought-provoking presentation, and I guess more generally for your continued leadership in this space, both in terms of the research that you do, but also the way that you proactively use that research for advocacy purposes. It has struck me since I've been in Australia. I moved here 5 years ago, that your name pops up a lot when it comes to making the case for this type of positive change. And it's that kind of unwavering enthusiasm and commitment that I think will bring about change over time, along with a coalition of others, many of whom I can see are participants on the call. So thank you for everything that you do. I thought I would start with a quote. So I quoted a paper by Deborah Dawson and colleagues, which was written in 1998 when I responded to a paper by Jürgen Riem and colleagues, which I guess was reflecting on the demise of the usefulness of self-report surveys and what might be done to improve their utility. And that quote, which is almost 30 years old, was that improving the measurement of consumption of alcohol has remained one of the most elusive goals of alcohol research. And continued efforts to improve methods for estimating consumption need to be moderated by the realization that no method is likely to be ideal for all purposes. So I think that's been recognised for a long time. And from my experience in Scotland, where by all accounts we were data rich, so the Scottish Government established what was known as the MISAS programme, monitoring and evaluating Scotland's alcohol strategy. And very fortuitously, we stumbled across a market research company which I think serves the same purpose as the Retail Drinks Australia, but aren't an alcohol lobby group. And so through that market research company, we were able to purchase on an ongoing basis alcohol retail sales data, both for the off-trade and for the on-trade in Scotland and also in England and Wales. And it was an absolute game changer in terms of being able to monitor alcohol consumption at the population level consistently over time. We had weekly data by drink category and subcategory. We had data on the price at which alcohol was being sold. So in terms of advocating for the kind of WHO best buys, including action on alcohol price, it was absolutely invaluable for making the case for why something had to be done in Scotland. And then at the other side of the implementation of minimum unit pricing and the ban on multi-buy promotions, we had the data that was required in order to evaluate its effectiveness. So I think it was really useful, and I think it probably belongs at the top of your tier, Nick, in terms of being the best available data. I suspect that data is there and it is ready to be used. I think Retail Drinks Australia have those data, and I think they'll be leveraging all the electronic point of sale systems that exist. And so it's just about what can be done to access those data, and that is the million-dollar question. Some other reflections, I wouldn't disregard self-report surveys from the collection of data that is necessary and useful. I think it does still play a role. And I think it's worthwhile thinking beyond the existing national population surveys. In the UK, a market research company called Kantar has a household panel data, so a longitudinal panel study, which asks respondents to scan all of their take-home purchases from supermarkets and other grocery stores, including alcohol. And that became a very valuable source when it came to evaluating minimum unit pricing. I don't think that exists in Australia, but there's no reason why it shouldn't. It would be expensive, it would be a big project, but it's possible. And the coverage of consumption based on those data was higher than what you would get from more traditional quantity frequency type self-reported surveys. And the granularity of the data also ticked some of those characteristics from the retail data. So worth exploring new areas. Similarly, Kantar also produced Alcohol Vision, which is a monthly retrospective drinking diary that respondents fill out over 7 days, but the data are collected and reported monthly. Again, that's been used by John Holmes and his team at Sheffield to explore some really fascinating facets of drinking, including drinking occasions and what's been drank in what settings and so on. So I think there are opportunities to explore new avenues, as well as continuing to bang the drum for the need for the alcohol retail sales data and the better wholesaler data and taxation data and so on. Another addition might be wastewater analysis. Like all the others, it has its own limitations, but triangulation is likely to be necessary and important regardless of what suite of data are available. And then just finally touching on not the what it is that needs to be done, but how to do it. And I think that is a big challenge from my experience in Australia. The first thing that I did when I came here was phoned Nielsen, which is a market research company in the UK that collects the alcohol data, and asked them if they had similar data for Australia. They never quite laughed on the phone, but I could sense a smirk on the other side of the line, which gave me an indication of how difficult it is to access such data in Australia. But who knows? I mean, continued advocacy, legislation is possible. There's a precedent in the Northern Territory. And so, yeah, continue to advocate with the data that are available, with the increases in harm that we've seen in recent years, all of that with the advocacy organisations and the academics all singing from the same hymn sheet, I think can only be a benefit. So yeah, I think that's all from me. I'm very happy to speak to my experience in Scotland if that can be helpful, but otherwise, thanks again, Nick, for a brilliant presentation.
Thanks, Nick, and thanks, Mark, for those. That's really insightful as well. We've got a few questions coming in, so I'll start with those. But we've got one of the first questions is really asking about this question of burden of data collection, given the kind of the way that there's an assumption that a lot of the data collection would come from automated systems. So kind of if you want to unpack a bit what the burden of collection is, both for the retailer, but also for maybe for the government agency, as far as we've seen so far.
Yeah, so I mean, in my experience, there are really two areas that burden can be created. I mean, you've sort of summarized them there a bit, Michaela, but the burden that the alcohol industry often talks about is not necessarily, it's not in a system that has an automated process like the big businesses do. It'll be the argument that there's plenty of small retailers that don't have whether it's $10,000 or $100,000 systems that are apparently required to establish those automated processes. Apparently is probably a bit too cynical there. You know, software is expensive, registers are expensive, scanners are expensive. It is difficult to build those things up when you out of your own pocket. But it isn't impossible. And, you know, this is sort of why I pointed in that last slide that Retail Drinks is lobbying the government for funding to improve security infrastructure in and around large and small retailers. But, you know, when you think about the levels of harm, I do think that it would be better used in improving their sales systems. And, you know, this kind of technology is becoming more common and cheaper as well over time. I don't know if the arguments that we used 20 years ago about the burden are quite as sound today as they were back then. They are still being made. I mean, they're being made as recently as 2019 in the Northern Territory. That exact argument was made. And then so that's retailer burden. Then there's burden from the government, which is higher than you might think. Retailers will commonly not comply with this kind of legislation when it is in place. We've seen that in King's Cross. I have like this King's Cross data set, hourly data set of all the nightclubs reporting how much alcohol they're selling. And there are 5 nightclubs, or not nightclubs, there are 5 retailers, late night retailers in there that never report their data. And then there are others that come in and out across the entire period. So the burden of that falls on the liquor regulator. And, you know, sometimes that's about improving enforcement, but it might also be about, you know, engaging other people and groups that work in the sector to try and improve these systems for the benefit of everybody.
I'm going to skip around. Like, I know this, like, sorry, I'm not going in kind of chronological order here, but Michael Livingston, hi Michael, has kind of put in a question about seeing kind of, this is for both Mark and Nick, about thoughts about how we can better marshal government, NGOs and researchers to improve data in this space. Like Michael's referencing the NAT stuff that's very definitely kind of the relatively modest progress. So like ideas on what we can do here.
I'm happy to take an initial stab at this one. But so one of the things that led up to this presentation was me going through the 2019 liquor bill in the Northern Territory. And so that was the proposed legislation. And there were hearings in response to that. They were attended by, you know, advocacy groups like FAIR, as well as ones in the Northern Territory. There, as well as Retail Drinks was there, as well as Hotels Association representatives. And, you know, they were discussing the bill, and where they discussed the collection of retail sales data, there was only one group who indicated that they knew the benefit of the retail sales data collection, and that was Retail Drinks. And they used it in an argument to, you know, say this is why it wasn't necessary. When other groups and other figures talked about the retail sales data, they weren't aware of the benefits around it. They had some idea of some vague benefits, but not the point of sales benefits that would be the real major benefit from that policy change over wholesaler data that they already collect. So I think a really important thing to do is organize presentations like this one that are aimed at informing people of the benefits of all these different methods of collection. I don't think that knowledge is necessarily out there. It's certainly contained within a few alcohol researchers' brains, but it's not as widespread as we'd like it to be. So I do think that we need to continually advocate and push forward. You know, here is why this data is good. Here's why it's important. Here's why it'll actually be beneficial for everyone involved to be collecting it. And yeah, Mark, do you have any further thoughts?
Yeah, I do. Thanks, Michael, for the question. I think it's an important thing to do, is to marshal all of those with expertise and interest in this area, and how that's done operationally, perhaps a national network, a national working group. Because I think, as Nick says, this is almost a starting point, but if you can collate some of these insights and actually start to develop resources that can help for advocacy purposes. So I really liked your slide, Nick, that articulated the benefits of having those data. So if an increasing number of organizations, government agencies can see the benefit of accessing these types of data, drawing on examples from across the world, and Scotland would be a particularly good case study, I think, given the use of retail sales data for informing and evaluating policy, then you might just start to increase awareness and increase interest among those policymakers and decision makers who perhaps have some of the levers that need to be pulled to bring about the change.
I've just thought of another point I wanted to add to that. I was just reminded of an experience I had where I gave a very similar presentation to some people working in the government. And one of them, when I said that we should have better data collection, one of them said, that's obviously an expense, and what would that actually show us over the associations we already know exist? And I think something that's important to keep in mind is that we don't know all the associations that exist. And we don't know what trends are emerging. Mark one of the really important points he brought up when he first started speaking was that the retail sales data that they had access to allowed them to make the case that the harm was occurring in Scotland. It illuminated the nature of the picture, and making that case as well. That we don't actually really understand what's going on without this data, I think is also important.
So talking about trends and what we might be getting and missing, there's a question here from Lynette about the consumption of methylated spirits and also of like hand sanitizers and alcohol substitute, and a question about kind of whether this is an emerging issue and also how you could possibly be covering that.
I'm happy to jump in, Nick.
Please do.
Yeah, it's a good question, Lynette. I don't know personally if it's an emerging issue, but it sounds like it could be based on your own expertise. I think capturing that type of data is notoriously difficult, but it was on our minds when we interrogated the validity and reliability of the very sales data that we're pitching as being sort of up towards a gold standard. So those data, alongside lots of other data, have gaps. And one of the gaps was substitute alcohol. And the extent we were particularly concerned that the introduction of minimum unit pricing could affect particular subgroups of the population in terms of their access and need for substitute alcohol. And so we embedded that into our evaluation approach, but we didn't establish a consistent source of data to do that. It was essentially asking people within particular studies the extent to which they had used or saw others use substitute alcohol. And there are others like homebrew as well. So the homebrew market and the extent to which that could be captured or changed. So these things are difficult to do, but should never be forgotten when using other data to assess the impact of different policies and strategies.
I'm going to try and get through this. So we've got two kind of questions here about, which I really think are more suggestions of things we could kind of leverage in this space. One being AI, and the other one being loyalty programs in supermarkets that the major retailers have.
So I do have some thoughts on the loyalty programs. Particularly, we have seen in some of the industry reports that have come out that loyalty programs are used to, track customers. I think this might be obvious. I don't know how obvious it is to everyone. Track customers, collect their data over multiple purchases, and get a better picture of them. And then it's also used in these, industry research reports to make cases around, the heavy drinkers are actually drinking this, so it won't actually be this policy won't affect it, so you don't even need to worry about it. So, I mean, I think I've probably missed the actual point of the question. I just wanted to say they are being leveraged. And in terms of like government or research getting into this space and making use of loyalty programs, privacy is going to be an obvious concern there. I don't necessarily think that, because the industry is doing it, that means that we don't have to care about people's privacy. But it is being done currently, and it's being done for the purposes of forwarding business interests.
We're going to have to wrap up really quickly, but I'm just going to say that Fiona had an observation here about alcohol controls seeming to be stronger at the international level and weaker in Australian jurisdictions, and thoughts about whether that might also relate with this kind of weaker vision we have of alcohol consumption monitoring in Australia versus places like Scotland.
Without a doubt. I mean, when I compare to Scotland, so I was shocked when I moved to Australia when I went to the bottle shop, and the scale of alcohol that was sold on promotion and the scale of the advertising of those promotion shocked me, purely because I had become normalized to a context where that's not permitted, and it very quickly became the norm in Scotland not to see that. And so I think, and the time at which alcohol is allowed to be sold, especially in Queensland, I think it's interesting. There is a lot of availability, and alcohol is sold cheap comparatively to Scotland.
That's a good point to end on. There's more comments in the chat, but we reach out to Nick or Mark to talk about this at any time, particularly about that can of worms that's come up in the chat. But I want to thank everyone for coming today. It's been really interesting and informative, and we're going to bring the webinar to the close, but I want to let you know about some of our upcoming webinars. We've got Substance Use Disorder and Pregnancy, What Does It Mean for Mothers by Dr. Kelly McNamara on the 23rd of October. And then Dr. Peter Gates from NDOC will be talking to us about community action to reduce AOD harms. Where are we now? And lessons learned on the 6th of November. So I hope you all enjoyed this session, and we look forward to having you join us for the next installment on Thursday at 3 p.m. Have a good afternoon, everyone. Thank you.